Assalamualaikum warahmatullahi wabarakatuh. Hello, everyone. Good night, ladies and gentlemen. How was your day? Was it good? I hope it's good because today I have the opportunity to be a presentation for this international seminar. So before we start our international seminar, let me introduce myself. My name is Aliyah Salsabila Malay. I'm a student from Medical Education Study Program, Faculty of Medicine and Health Education, University of Bengkulu, 2021. My NPM is H1A021041. In this opportunity, I will like to tell about factor predisposing to peptic ulcer disease among patients attending gastrointestinal clinic in two selected tertiary hospital in Ogun State, Nigeria, by IROEGBU, Chioma, Anita, and Dr. POPOOLA. So, in this seminar, we'll divide it to be 5 sessions. First, introduction. Second, methodology. Third, result. Fourth, discussion. And fifth, conclusion. First, introduction. So, what is P.O.D.? P.O.D. or peptic ulcer disease, as well as the causes of its complication, is as usual medical of its complication encountered by the gastroenterologists worldwide. Ulcers are the first group of ulcerative disorder that occur in gastrointestinal tract. P.O.D. is clinically defined as a disruption of the continuity of the gastrointestinal mucosal lining, leading to sore of about 5 mm in diameter in endoscopic finding. P.O.D. is an endoscopic diagnosis in contrast to dyspepsia, which is a clinical diagnosis based on symptom alone. P.O.D. occurs in distal esophagus, jejunum, and diverticulum with heteroptic gastric mucosa and mostly in stomach and first part of duodenum. P.O.D. is broadly classified as gastric ulcers and duodenal ulcers depending on the section of the gastrointestinal tract that is affected. Another type of P.O.D. is the idiopathic P.O.D. described as a peptic ulcer with no definite causes such as Helicobacter pylori infection and hypergastrinemia. And then P.O.D. is caused by an imbalance of acid secretion, which includes gastric acidity, pepsin, Helicobacter pylori infection, and non-steroidal anti-inflammatory drug or NSAIDs, mucosal blood flow, mucosal defense, such as gastric mucus layer, prostaglandin, bicarbonate that resists acid digestion, while the activities of Helicobacter pylori causes imbalance in acid production and regulation through inflammation, induce increased gastrin section, and decrease somatostatin secretion. NSAIDs tend to affect the cyclooxygenesis pathways, leading to the production of prostaglandins, prostaxylin, and thromboxane, which alter the mucosal protection mechanism, subsequently damage the mucosal surface of the affected region. And then, what the impact of P.O.D. on life? Is an essential cause of illness and death globally, affecting the life of millions of people in their everyday life in the United States. An estimate of 4 million people has peptic ulcers that is duodenal and gastric, with about 350% new cases yearly. Also, about 180,000 patients are hospitalized yearly, and while about 5,000 people die yearly as a result of peptic ulcer disease. the likelihood of developing peptic occur in the one of lifetime is about 4% for female and 10% for male. POPOOLA impact negatively on the whole related quality of life of affected individuals. Also, employer as well as healthcare system are burdened with high economic costs as dealing with the disease. Despite studies in various parts of the world on peptic ulcer disease, the condition has remained among the world leading cause of morbidity and mortality, while little attention has been paid to the factor associated with P.O.D. in Ogun state. And then, what the methodology? Descriptive quantitative research design was adopted to assess the factor. The population for this study consists of all patients 18 years and above attending adult UIT clinic in the two selected teaching hospital in Ogun. The instrument used for data collection for this study was a structured questionnaire which consists of 3 sections, A, B, and C. Section A contains 11 questions and measure the socio-demographic variable associated PUD. Section B contains 11 questions which measure the knowledge of PUD among study participants and was categorized as low, moderate, and adequate knowledge. And section C contains about 19 questions with measured the factor influencing PUD. Making a total of 41 questions, data collected was analyzed using statistical package of social science, descriptive statistic of frequency count, and percentage were used to answer the result of question. And what is the result of methodology? In the table 3, history of medical condition, present above showed the level of history of medical condition. About 51.4% of the participants report not to have hypertension, followed by 75.7% of the participants who report not to have arthritis, and 50.7% report to have been screened for PUD, and followed by 63.6% reporting that they have members of their families who suffer from PUD, and 67.1% report not to have diabetes mellitus, while about 57.1% report not to have history of PUD. And then in the table 4, summary of level of prevalence of Helicobacter pylori infection indicate that there was moderate prevalence of Helicobacter pylori infection among the participants present in the 2 tertiary hospital, while about 38.3% of the patients in BUTH had low prevalence of Helicobacter pylori infection. About 31.3% was reported in FMC. About 11.7% of the participants in BUTH had high level of prevalence, while about 13.8% of those in FMC Abeokuta report high level of Helicobacter pylori infection. And in the table 5, factor associated with peptic disease, that Helicobacter pylori infection is with PUD 70% report level of education for both hospital, 71.7% and 76.3% of the participants from the two hospital also report occupation over 60% also report religion is not associated factor for POD. Over 73.3% of the respondent report gender is not associated with POD. And discussion. First, the result of research question 1 showed that about 63.3% of the participants had high level of knowledge about POD from the two tertiary hospital. Report significant difference in the knowledge of the participant based on their gender, age, level of education, and what associated with male gender, age group, and graduate participant. And two, the result of the analysis report based on the history of medical condition, hypertension was reported to be the most significantly common followed by arthritis. So they report that patients with hypertension and diabetes mellitus are often at highest risk of POD and thus residing in low and middle income countries of the world. NSAIDs associated complications, however, are 6 times more frequent in the upper gastrointestinal tract than in the lower GI tract. And then third, the result on the level of Helicobacter pylori infection indicate that there was a moderate prevalence Helicobacter pylori infection among the participants present in the two tertiary hospital. So prevalence of Helicobacter pylori is influenced by multiple factors such as age, host generic, predisposition, sanitation, dietary, and socioeconomic. And last than the result on the factor associated with POD among study participants in the two selected tertiary hospitally showed that majority of the patients report to consume alcoholic beverage. And last than in this agenda of seminar is conclusion of this presentation. So the conclusion of this presentation is the study conclude that about 60% of the participants have moderate level of knowledge about POD. Most of the factor influencing POD was reported to be intake of NSAIDs and steroid, the consumption of alcoholic beverage followed by smoking. Majority of the participants report medical condition affecting the patient in the term of the level. As one of the most common medical condition affecting the patient in the Helicobacter pylori, there was over 50% moderate level of Helicobacter pylori infection. So that was from me. Thank you for your kind attention. I hope this will be beneficial for you all of us.